How to lower blood pressure quickly and naturally. When someone has high blood pressure, also known as hypertension, it means that their blood is pumping with too much force against the walls of the artery. The condition may eventually lead to heart disease, stroke, or other heart conditions. Hypertension is extremely common in the United States. What is good blood pressure? A good, normal blood pressure reading while seated with a blood pressure cuff should be 120/80. The first number is systolic blood pressure, and the second is diastolic blood pressure. Dr. Osborne says those numbers apply across the board for adults over 18 years of age. He said that decades ago, the number of good blood pressure varied based on age, limiting some people to this day. But in reality, it is all standardized to 120/80. A very large proportion of hypertension is in adults, he says. It's independent of age. It doesn't matter if you're 21 or 81. The numbers are the same. For adults, that is. For children, it is slightly different. Blood pressure numbers vary depending on population and age and are generally lower than in adults. There is not a standardized set of guidelines for children, but certainly if you come across a child who repeatedly has blood pressure that will be high according to the adult category, Dr. Osborne explains. What is the dangerous level of blood pressure? As far as specific numbers for hypertension, the American Heart Association and American College of Cardiology issued updated guidelines in November 2017. It can be divided into two categories: advanced and high. Elevated blood pressure ranges from 121/80, 129/80. It is usually not treated, but it serves more as a warning sign that it should be monitored, and the patient can detect a lowering of blood pressure by making certain lifestyle changes. High blood pressure starts at 130/80 or higher, which is a phase. Stage 2, or the worst degree, is 140/90 and up. If the upper limit of blood pressure exceeds 180, it actually starts to be dangerous, increasing the likelihood of an immediate heart attack, heart failure, or stroke. Fruit, vegetables, whole grains, avocados, banana, spinach, walnuts and seeds, kefir, dark chocolate. What is the best natural supplement for high blood pressure? 3 main minerals are used to lower blood pressure naturally. If you follow a heart-healthy diet, you are likely to get enough of these from your meals, but for people with poor eating habits, supplements may be a good idea. Try these: calcium, magnesium, potassium. Some people may recommend taking a potassium supplement, but it is especially important to test your current potassium levels before doing so. Too much potassium can have potentially fatal side effects. What can I do to lower my blood pressure? How to lower blood pressure with lifestyle changes. Exercise. Make regular physical activity a part of your routine. Even just half an hour per day can boost health and help you gain healthy weight. Aerobic exercise in particular has been studied as a possible non-pharmacological treatment for hypertension. While you're on the phone, try taking the stairs to work or walking around. Weight loss. Even just losing 2 pounds can reduce systolic blood pressure, doctors says De Palma. Typically, if someone loses up to 5% of their body weight, it will have a significant effect on blood pressure. Avoid all nicotine. Quit this stimulant in all its forms, such as smoking, vaping, patches, and chewing. Avoid medications. Recreational drugs can affect your blood pressure in addition to every other part of your life. Monitor your medications. Some medicines and supplements may alter the effectiveness of blood pressure medication. Practice mindfulness. Reduce stress and lower your blood pressure. When you feel your blood pressure rise, try to take a deep breath. How to reduce blood pressure quickly. First and foremost, if you feel that you have a complaint of high blood pressure, such as a stroke, heart attack, or anything else, seek immediate medical attention. Do not attempt to solve these problems on your own. You need extensive care. Otherwise, when you feel that your blood pressure may be too high and you want to reduce it quickly, Dr. Osborne suggested calming down. What are you doing and stop sitting? Take a few deep breaths. If you do not get that help, call your doctor. If this is a constant problem, then exercise and try to change your diet. Your blood pressure may take up to a few weeks or a month to see its effects, so keep away for best results. Keep in mind that in some cases, blood pressure medication may be necessary if you are not taking it. Thanks for watching. Like, share and subscribe for more videos.